Fixed right now. I appreciate your patience. Good evening. My name is Liz Lucas. I'm the manager of community benefit for Valley Hospital. Welcome to our live virtual event in partnership with the Montvale Library. Program this evening is Pinpointing Pain, Acupuncture for Back Pain, Arthritis, and Migraines. Just a few introductions or announcements before we start our presentation this evening. If at any time you have questions, please feel free to submit them through the Q&A button located at the bottom of the Zoom screen. Please feel free to submit questions at any time during the presentation, and we'll have time after the presentation is over to address some questions. And we ask that you keep your questions general. And for any specific questions regarding your health, we recommend that you follow up with your physician. At the completion of this event, you will receive another email from Valley's Community Health Department, which will include a link taking you to an anonymous survey about the event. Please take a moment to complete that survey, and we appreciate your feedback. Most live events will be recorded and posted on Valley's website. And for a listing of videos on other health topics, please visit valleyhealth.com/tuneintohealth. We update the site frequently with new videos, and this one should be uploaded by early next week. So now I'd like to introduce our speakers for this evening. Daniel Yu is a nationally board-certified acupuncturist and herbalist with 8 years of experience. Combining Eastern and Western medicine, he specializes in pain management and sports medicine, as well as treating digestive issues, headaches, insomnia, stress, and more. Trained in Korean, Japanese, and Chinese medicine, his methods include acupuncture, cupping, and other integrative therapies. And Dan is passionate about patient-centered care. And we also have Christine Yun, who is a nationally board-certified acupuncture and herbalist with over 7 years of clinical experience. With a background in biological sciences and psychology, she specializes in comprehensive stress and pain management by addressing the physical, emotional, and mental aspects of health. Christine is trained in Korean, Japanese, and traditional Chinese medicine, TCM, acupuncture, as well as cupping and other therapeutic interventions. She has extensive experience treating orthopedic conditions, digestive issues, anxiety, depression, insomnia, and a wide range of women's health concerns. Her integrative, patient-centered approach helps individuals achieve long-lasting and overall well-being. Welcome, Daniel and Christine.
Thank you, Liz. Thank you, everyone, for coming in this evening to listen to our webinar. And thank you very much for your patience, because we had some technical difficulties, but I'll get started right away. So before I dive into our topic this evening, I wanted to give a definition of integrative medicine and give some information about our practice. Integrative medicine is a combination of ancient healing techniques and modern medicine in order to provide individualized treatment plans to optimize your health. Our practice is currently located at 970 Linwood Avenue in Paramus, and we have plans on opening up a second location in Montvale later this fall. Our current established service lines include chiropractic care and acupuncture, and we do have a new service line starting next week in the form of therapeutic massage. You can call in to ask about the rates for that particular service. So again, the topic is pinpointing pain, acupuncture for back pain, arthritis, and migraines. And this is the overall presentation outline I'm going to be doing tonight. First off, I'm going to give an introduction and background on traditional Chinese medicine, or TCM. Next, go into defining what acupuncture is and what it can do. Then I'll go into briefly talking about arthritis, low back pain, and migraines. And following up that, what kind of benefits you will receive getting acupuncture in order to treat for these particular conditions. And then we'll close it off with questions and answers. So traditional Chinese medicine, what is it? So it's a medical system that was developed in ancient China about 3,500 years ago. And traditional Chinese medicine is quite unfamiliar for a lot of people, and they do have a lot of different esoteric terms. So I thought the best way to actually introduce this is actually doing a head-to-head comparison with modern medicine. So on this slide, you'll see a table. On the first column on the left is core beliefs or principles behind modern medicine, and on the right, you'll see the ones for traditional Chinese medicine. So with TCM, everything is focused on the individual. And back in the 2000s, when scientists uh, discovered the human genome and actually researched into it, they found that the 99% of our genes are identical. And it's the 1% that makes us very unique. Unique to the point that actually you have distinctive physical characteristics as well as even drivers of behavior and emotions. And because of that particular instance, that's why we look at the individuals as a unique set of symptoms when they come in for care. And when we look at the individual, we're not looking at a very specific subset of the person. We're looking at the individual as a whole. What are the different interactions that you'll have within different tissues as well as organ systems in the body? So when you come in for a treatment, you're coming in with a chief complaint. We're looking for the root causes of those particular symptoms. And when we do get an idea of what that is, we start tapping into the innate healing abilities of our body. And the way we do is by accessing different modalities like acupuncture or natural compounds or herbs. And once the healing takes effect, then we start shifting over to more of a preventative and maintenance health mode, which makes sure that the chief complaint doesn't come back or improves your quality of life in order to maintain it. So a lot of this has actually been knowledge that's been collected over centuries from ancient China. And this is a little bit different from the evidence-based medicine you'll see in modern medicine, where they follow a scientific method. In with modern medicine, you have an idea, you have an hypothesis, you test it, and then go back and retest it to see if it's actually recommendable and set into practice. But with Chinese medicine, what happened was that the scientific method wasn't really in place. What ended up happening is that when you come in with a certain condition, they will literally throw everything at you, including the kitchen sink, and they go back and figure out what was working. So that's kind of like a distinction between uh, the TCM and modern medicine. Now, just because these principles are very distinct doesn't necessarily mean they're totally divorced from each other. There are opportunities for synergism and overlap, and I'll give you one good example. So in the 70s and 80s, there was research going on where scientists actually were looking at different Chinese herbs and compounds. And one of them was actually called sweet wormwood. And what they found, it was essentially useful in Chinese medicine for a lot of fevers. But through modern medicine techniques, they were able to extract compounds and they were able to use that for the first line defense for malaria. So that kind of example kind of gives an idea of how things in even in Chinese medicine, you could kind of use that knowledge in a Western medicine approach to figure out new compounds, new drugs, new methods of treatment. So, in terms of the foundations of traditional Chinese medicine, how did the ancient Chinese come up with their system of medicine? So, if you think back 3,500 years ago, it is just the Bronze Age. We're like coming out of the Bronze Age. So, there was not enough there. Like, there wasn't a system of medicine where people will go and have anything that resembled modern medicine. But in order to create a system medicine, you have to first develop some type of theoretical framework. And what the ancient Chinese looked for was everything around them. They looked toward nature as the reference point. So by through these observations, they noticed that there were certain processes or functions or like rhythms or cycles within nature. And because it occurs in nature, it can also occur within our bodies. And they started cataloging these particular patterns. And that's how TCM started to develop. And the overall focus of TCM is to balance a lot of these rhythms and cycles and these dynamic forces that occur in the body. So when it comes to these dynamic forces, one way of representing this is through this particular symbol. I'm pretty sure a lot people have seen this before. It's called yin yang symbol, or they call it Tai Chi. The light colored area is the yang portion of it, and the dark colored portion is the yin. And these are two mutually dependent forces, and they're in constant state of flux and movement. Nothing is really static. And what happens is that you start seeing these little within the yang, large yang portion of you see that small black dot, and vice versa. It's an indication that things are always in transition and nothing is really absolute. So one example I can give is how you through the yin and yang you look at heart rate. So if you're going to your gym and running and getting your heart rate up, that is a yang function. And as you come through a cool down period, you eventually notice that your heart kind of starts settling down and going back to its baseline heart rate, and that is a yin function. So again, this movement up where the heart rate goes up is yang, and then coming back down is more yin. Again, the same for our breathing, where the expansion of our ribs as we take a breath in is more of a yang function, and the contraction as we expel our air out is a yin function. So the yin and yang is not really something that's in our bodies, but it's the ancient Chinese way of representing a lot of these different opposing forces that are these natural processes that occur in our bodies. So when things are in balance, the assumption is that we are healthy. But when an imbalance occurs within the dynamic force, you start creating a disease state. And thankfully, our bodies are fully capable of self-repair, and we don't really notice the repair going on, which is what is supposed to happen. But when there's a persistent level of imbalance that occurs, or a system-wide imbalances all over our body, then we start noticing these signs, symptoms, and we start developing acute, subacute, or even chronic conditions. Now, if the imbalance occurs in just one system, is relatively easier to treat. But with traditional Chinese medicine, everything is interconnected. So when something happens in one system, something else can be affected downstream or upstream or anywhere else in the body. And when this kind of happens, you have this domino or tumbling effect that where it builds up into more problems down the line. So, how do you treat for some of these imbalances? And one approach that we take is utilizing acupuncture. And acupuncture is a modality in traditional Chinese medicine that involves inserting very fine needles into your skin in order to balance your body's vital energy, or what we call qi. And vital energy is not equivalent to what you would call like a standard term for energy in our body, or like calories that we take in or expel, or it's not equivalent to the energy currency of our body known as ATP. What vital energy is, all the life processes that occur in our bodies that animate us and give us life, that's what we call chi, or vital energy. So how does this overall work? So there are over 360 acupuncture points in the body, and they're arranged into these series of lines that are distributed all across our body, up and down our body. And they're called meridians, and this is where chi flows. Anytime there's an imbalance within these pathways is when a disease state occur, and you have a congestive phase of it, or there's a lack of flow, or there's too much flow, and acupuncture is used to regulate these pathways. So in order to expand upon this and give you more of like a visual about how this works, this is what I call a garden hose example. You take a garden hose and you use it to water your garden. The moment you actually put a kink in that garden hose, there's no more water coming out. So what ends up happening to the garden itself, it eventually dies. That is what a congestive phase of your body is, a congestive portion of your pathway. The next example is like, what if you take that same garden hose and you turn on the water and turn it high, really high, and increase the water pressure and start shooting out like a fire hydrant? Again, that's not a healthy thing for your garden, because you could eventually kill off your plants again. The next example is more of a deficiency state. Take the same garden hose and reduce the water pressure, only this time it all comes out in drips. And that's still not enough for your garden. So eventually your garden will be affected negatively. So acupuncture, when you come in on the first example, is you unravel the garden hose to get out the kink in order for the water to properly flow again. The second example with a fire hydrant, if it's coming out too strong, the acupuncture can be used to moderate or reduce the pressure in order to get the proper flow that you need. And the last example is when there's too little coming out, acupuncture again can be utilized to increase the pressure so your garden is able to get the vital resource that it needs. So I'm going to jump right in and talk about briefly about arthritis to start off. So arthritis is an inflammatory condition within your joints that cause a lot of pain, swelling, inflammation, and sometimes even deformities. And it affects over 50 million Americans and affects 350 million people worldwide. And these are very broad categories of arthritis. The first common one that we see is what we call degenerative arthritis, and it's also known as osteoarthritis. And this is the bone on bone where the cartilage worn away through like mechanical stress or injuries, often linked with aging. And it's the wear and tear that people commonly say when they have this particular type of arthritis. Next one is inflammatory arthritis, and this is more the joint inflammation and damage due to an autoimmune condition. And an autoimmune condition is where your immune system starts attacking your own tissues and your bones. And some of the common arthritic symptoms associated with this are the rheumatoid arthritis, psoriatic arthritis, something called ankylosing spondylitis, where the vertebrae start fusing together. Next, you have metabolic arthritis, and this is joint pain and inflammation associated with a metabolic process, like gout, where you're starting to develop these uric acid crystals that get embedded into the bones, specifically in your toes, and causes a severe amount of pain. And lastly is septic arthritis, and this is joint pain and inflammation associated with an infection, either a bacterial, virus, or fungal. And a lot of these arthritic conditions, just because they're boxed this way, doesn't mean that they're separate from each other. You could have overlap, or you have certain metabolic drivers associated with some of these arthritic conditions. So let's say if it was a metabolic arthritis condition and you come in with certain comorbidities like diabetes or obesity, you could still have metabolic arthritis, but also degenerative arthritis. So it doesn't necessarily mean you have one, doesn't mean you have others. There is some considerable overlap at times. So what is lower back pain? Lower back pain, we describe it as pain that is located between the lower ribs and your buttocks, and sometimes they could cause radiating pain into your lower extremities. One of the most common complaints that we see within our clinic. And there are three different subtypes to this. There's an acute phase to the lower back pain, which is less pain that occurred for less than 6 weeks. You have a subacute phase, where it's 6 to 12 weeks, and chronic, which is more than 12 weeks. And again, these are just more common causes of low back pain, very broad categories. We do see a lot of like the mechanical disorders associated with back pain. So this is like your muscle strain, kind of pulling your muscles if you're kind of lifting anything heavy, or people getting back spasms from doing even simple tasks like lifting up a sock or bending it wrong. Ligament sprains, disc degeneration. This also includes like bulging disc, herniated disc, and these are mostly the common causes of low back pain. You also could have joint dysfunction, and this is associated with the sacroiliac joint, which is where two areas of the bones in your lower back meet. So one is the hip bone, and one is the sacrum, which is the lower part of your spine, and that junction is the sacroiliac joint. And areas in this kind of area where there's a lot of inflammation and pain can also cause radiating symptoms into your hip or your legs. You could also have nerve irritation as a driver of your lower back pain. Piriformis syndrome is quite common. People also refer to it sometimes as sciatica, or even you have radiculopathy, where you'll have herniated disc in your back pinching on the nerve, causing radiating pain into your lower extremity. In terms of the piriformis syndrome, the piriformis is in your glutes, and that particular muscle, if it's swollen, irritated, it will start clamping down on the sciatic nerve, causing a lot of the irritation and the pain and the burning sensations. We also look out for red flags when we're treating for low back pain. And specifically, if there is any low back pain associated with infections, or if there's even the presence of a tumor or fractures, any type of systemic diseases, we generally go to refer patients to emergency rooms or their other providers to get a more thorough look, because we want to make sure some of these are taken care of before we start looking at other causes of low back pain. So, what is a migraine? So, migraine is a neurological disorder that manifests as a moderate to severe headache, and it's usually associated with a lot of like pulsing, throbbing sensations, and it can affect brain activities, and even including affecting your daily activities of life. Some of them have very complex symptoms associated with them. Some people could have dizziness, they could have nausea, they could have vomiting, they could feel fatigue, they could have visual disturbances. So there's a wide array of symptoms that are commonly associated with migraines. Peak age is between 15 to 49, with high prevalence at 35 to 39. Women are 3 times more likely to have migraines than men. Women around that 35 to 39 age kind of associate that with hormonal changes, and it's when there's peak demand on their body at that particular age, family life, work life. So they kind of look at stress as one of the big triggers for migraines. And over 1 billion people suffer from migraines globally. Again, these are very broad categories. There are other like forms of migraines and subtypes. Common one is the migraine without the aura. So again, like I described before, a lot of the throbbing, pulsing sensations. But the one with the aura is the migraine is preceded by these visual disturbances where you start seeing shines, like streams of color or like little spots in your field of vision. Um, and next is chronic migraines, which is migraines that occur more than 15 times in a month for the span of 3 months. Random migraines are migraines associated with visual disturbances, yes, but then they cause like partial or temporary blindness for a time. Hemiplegic migraine is associated with almost like motor or partial paralysis temporarily. Vestibular migraines, you could have a headache or not have a headache, but this is more associated with more balance issues and dizziness. Menstrual migraines are tied in with your menstrual cycle, so even before, like as a PMS, uh, women would have headaches or migraines, or even during the start of their cycle, even afterwards. So it's uh, it's a repeated pattern on a month-by-month basis. Abdominal migraines you see more commonly within children. Headaches may or not be present, but there's a lot of like nausea and vomiting, dizziness as well. But again, more so associated with children. So all in all, with these conditions, how does acupuncture help with this? And I just want to go into the mechanisms behind the acupuncture. A lot of the Western medicine scientists have done a lot of research into how acupuncture can be helpful and discovered a lot of different things associated with acupuncture treatments. One is a nervous system activation, and that is where the acupuncture can have tap into different branches of your nervous system, and one of them is responsible for fight or flight. When you get an acupuncture treatment, it helps regulate that particular branch and moves it over to more of a relaxation digestion mode, as well as kind of reducing a lot of the stress hormones associated with it. So there's also a neurotransmitter modulation. So when you get an acupuncture treatment, there's a lot of endorphins or these natural painkillers that are released. And patients describe the relief that they get from acupuncture is equivalent to getting a shot of morphine. So there's a lot of pain relief, as well as for patients who have chronic pain. It's an effective form of pain management. There is increased circulation. There is improvements to blood flow, as in order to remove like waste products, or even it's great for lymphatic drainage. Even local effects with acupuncture have been helpful. I'm pretty sure people have been hearing the term dry needling being thrown around. That is essentially needling into trigger points or motor points, these tight bands of muscle in the body. And we we commonly use that in order to help with patients with orthopedic problems and to help them reduce pain as well as regain function and range of motion. The other aspect of acupuncture is that it also helps drive down inflammation. So anybody coming in with a lot of autoimmune conditions, it helps to regulate your immune system to kind of drive the inflammatory markers down, like um, uh, CRPs as well as ESRs, which is very associated with autoimmune markers. Um, so all in all, that's kind of the mechanism behind how acupuncture works. So when you get a treatment, what kind of benefits do you receive? So there's definitely like increases in energy, circulation, reduction in stress. If it's an orthopedic problem, we do functional tests to see what engage your range of motion. And post acupuncture, we do that test again to see if there's any change to it. And usually there's an increase in range of motion. It promotes a sense of well-being. There's alterations to immune function, so we have patients coming in for their fall or seasonal allergies in preparation for that. Definite decreases in pain, helping with fatigue, reducing inflammation, helping with anxiety, stress, depression. So these are overall the benefits for acupuncture. So in conclusion, TCM is more about finding the balance within our bodies. It's looking at multiple symptoms, and looking at the symptoms and looking to see how everything is interconnected. And once we find that particular source, treating it so that you're able to kind of start the healing process. And afterwards, looking out for any signs that things will reoccur and trying to prevent these problems from occurring again. And acupuncture helps with addressing specifically the lower back pain, arthritis, and migraines by reducing pain, reducing inflammation, increasing circulation. So before we jump into any specific questions and answers, I want to go over some of the common questions that Christine and I usually receive from patients. So the first question is, does insurance cover for acupuncture treatments? A lot of the major medical insurances do cover for it. Some of the insurance companies do have very specific stipulations or requirements. Um, Sometimes they are very specific about conditions that we treat. Others, they're very broad. And it's best to call in to get your insurance coverage verified before you start treatment. And if you don't have any coverage and don't have insurance, we do have very favorable cash rates for our services. For any new patient coming in, it'll be $140, and then any follow-ups will be $65. And do I need a prescription or a referral? While we appreciate a lot of physicians referring or providing prescriptions for acupuncture, you don't need a referral to start your acupuncture treatment. This question is given to us, asked quite commonly, does it hurt? So acupuncture, the needles are very fine and hair thin. Um, if you want to get a sense of what the acupuncture feels like, if you flick your wrist, that's usually what it feels like. But it's also dependent on the gauge of the needle, the size of the needle, as well as the skill of the practitioner. And a lot of times with those kind of elements and combined, it is a relatively painless experience. So what kind of needles do you use and do you reuse them? So we use very fine pre-sterilized needles that are single use only. So we've not reused any of the needles in order to avoid any cross infections or any risk for infections. How long is a treatment? So a first, a newcomer who's doing an initial evaluation will have a 60-minute treatment. So it'll be 30 minutes for the initial evaluation and then treatment afterwards for another 30 minutes. And the follow-ups are usually between 30 to 40 minutes. So how many treatments will it take to help my condition? And that really depends on the conditions. There's a lot of different factors we look into when you're coming in for your visit. And like I said, we don't look at it we look at your diagnosis, but we also have to look at everything else that's going on in your body that ties into it. So it's really dependent on what you're coming in with, how long you had it for, how severe is it, and that's how we get a better gauge of how many treatments it will take to provide you with the relief that you need. So I'd like to thank everybody and for coming for participating in the webinar today. And if you have any other questions, Liz, uh, feel free to ask.
Great. So if anyone has any questions, you can submit them through the Q&A button on your screen. Christine's been answering a couple specific questions that people have, but there's one, can acupuncture help shoulder pain where there is bone on bone?
Yeah, so and like the bone on bone is probably more associated with osteoarthritis. Um, if acupuncture can rebuild cartilage, I'll be in a whole new line of business. It'll be great, but it can't rebuild cartilage. But what it can potentially do is help reduce a lot of the pain associated with the bone on bone arthritic condition. Again, it's really dependent upon what else that might be driving that particular pain in the shoulder. So take for instance, if it was, let's say, a right shoulder pain, I'll also be looking at the left hip as a potential treatment area because those are interrelated. And the best example I can give is if you look at a baseball pitcher and the pitcher's throwing with their right arm, when they plant with their left foot and start spinning in order to throw, their left hip has to be intact and healthy in order for them to throw with their right shoulder. So these are the kind of associations that we look out for, and the reason why we have this almost like systematic and global view of the body is to see these type of connections. So again, it can potentially help, but like I said, there's other factors that may need to take into consideration in order to help with that particular type of pain.
Yeah, a couple of your frequently asked questions are showing up in here. Um, for instance, the number of sessions and such, but how often does someone come in for acupuncture? Is it the sort of thing that it's every day, every week?
So
Um,
it really depends. Again, it really depends on the condition. So a lot of times at the very beginning, Christine and I ask that patients come in a little bit more frequently. Acupuncture has this accumulative process where you're building up the effects in the body. So we like to get the ball rolling much more quickly. So a lot of times there's more frequent visits at the very beginning in order to pretty much treat for the chief complaint. And as we kind of go engage the response of the patient, and if they start feeling better, that's when we start tapering down their treatments. And depending on the condition, it could be more of a maintenance type where we're seeing each other for maybe once a month, or you're discharged from care because the pain is not a problem anymore.
okay. In reference to pain reduction, someone who has tinnitus related to an arthritic joint, can this help? Can it really help with something like this where there's not really any pain necessarily?
This is just tinnitus and separately pain, or there's no pain, but just tinnitus.
It says you talked a lot about acupuncture reducing pain. It was recommended to me for tinnitus related
Okay.
to it. So I guess it's more the tinnitus, not the
Oh,
pain.
yeah. So a lot of times it's again that's really dependent upon the type of tinnitus that you potentially would have. Uh, we do have instances. I have patients who do come to see me for tinnitus, and has it's been successful in reducing the either the frequency or the volume associated with it. But I still look out for certain types of tinnitus. So let's say if it was more like a they call it vestibular tinnitus. It's more like a blockage associated with it. So those are more for like there's I kind of look at it as more of like I need like to refer patients to. So it's very, very dependent upon what type of tinnitus it is. But um, certainly acupuncture has been helpful for the patients I've been seeing who have tinnitus.
Okay. Someone is asking, and I apologize for the mispronunciation of this. Can it help for trochanteric bursitis, hip?
For trochanteric bursitis, yeah. So we kind of look at bursitis as a lot of inflammation. So acupuncture is helpful for reducing a lot of the inflammation associated with bursitis. Again, we're kind of looking at what's causing the bursitis, the underlying reason for the bursitis in the first place. And that is the whole process that we take in order to find the root cause of it. Again, there could be multiple driving factors for it. It could be more like a mechanical disorder, or it could be a posture disorder, it could be a gait disorder, it could be a lot of different things that could be driving it. And a lot of times it's getting it evaluated by us and it gives us an idea of what may be driving it and causing it, then utilizing different styles of acupuncture to address it.
There are a couple questions here that I'm going to combine into
Mhm.
one. Um, Someone is asking if there's something unique about acupuncture at Valley because they've tried it in the past and noticed, haven't seen any noticeable results. And then another individual discussed an experience that they saw with a Chinese acupuncturist and kind of the difference between Western acupuncture um, and how there were various differences that weren't provided in Western health acupuncture environments. So they were curious, how does Valley bridge this gap in treatment?
Okay. So
It's a
so
lengthy post. If
yeah.
you, I don't know if Christine saw it, but it's um,
So for us, like we Christine and I both use different styles of acupuncture. There's Chinese, the traditional Chinese medicine, Japanese, and Korean. And Chinese is the more predominant one. Um, each of them have their own styles of acupuncture and different approaches to it. So you could have a practitioner have just doing needling locally into the area where the pain may be, or some practitioners will just utilize inserting points into the hands and feet to address the pain. So, take for example, if it was a low back pain, they could use the hands and feet to address it. They could use local needles into the back to address it. Um, I particularly use like a lot of abdominal needling, just needling into the stomach area. Um, some practitioners needle just into the ears or into the scalp or a combination thereof. So there's a lot of different ways of doing acupuncture, and it's just trying to figure out exactly which one resonates with you. It's it's a bit of a trial and error process because a lot of patients would go see some acupuncturists, right, and assume that that's the only way they do acupuncture, and it's not the case because there's so many different styles of it. And again, it's just a matter of figuring out which one responds better, and that's kind of what we do is because Christine and I have both the Korean, the Chinese, and the Japanese. We're able to kind of jump between these different styles to figure out which one's responding better, and that's why it's so different coming to see us.
okay. Do you need to be off pain medications for the initial evaluation?
No, you do not have to. A lot of times these pain medications are prescribed by physicians, and as you're getting the acupuncture, if you start noticing that the pain is better or being reduced, it's best to confer with the physician to see if you could start taking away some of the pain medication. But we still advise you continue to take it. We don't want to uh, dictate what your physicians already prescribed. And there's no need to change it.
Okay. And this person has back pain, like arthritis, and now has arthritis in the tip of their finger, which
Mhm.
prevents, I guess, straightening. Um, the finger can both be treated at the same time.
Yes, they can. So if you because the acupuncture it's very versatile in that sense. Just because you're coming in, let's say, with a chief complaint of low back pain, but then you have other back pain or other like areas of pain, you still tell us and we'll incorporate that into the treatment. It doesn't necessarily mean that just because you have to come in just with one singular condition. And there's also a possibility if you have back pain, there might be some kind of connection that we can see that might be also driving the pain in your fingers. So like I said, it's a matter of evaluating and figuring out the nuances of the body to figure out if there is a connection. And that's what we try to do.
I like this question. Can acupuncture help to stimulate hair regrowth?
Actually, funny you say that. I have a patient who is actually undergoing chemotherapy for cancer, and he was making an observation that the chemotherapy he's currently getting, his doctor told him that it's responsible for hair loss. And the style of acupuncture I've been using on him was a lot of scalp acupuncture as well as body, but predominantly a lot of like needles in the head. And strangely, he's been growing hair and it's been confusing his oncologist. So, yes, it has been helpful in helping regenerate his hair. And even in the past, we've been some patients have been noticing that some of the hair is growing back. But like it is also dependent upon uh, one genetic factors and what exactly is causing the hair loss in the first place. So, but in this particular instance, for my patient, he's very pleased with that that he's growing hair instead of losing it during his chemotherapy treatments.
That's great.
Mhm.
Um, let's see. This individual said you mentioned medical massage. Can you clarify?
It's therapeutic massages. I can't really attest, like, talk about too much. It's best to talk to the massage therapist because she's a recent addition to our practice, and she's very well qualified in various forms of massage, as well as her background is also she was a massage teacher. So she has knowledge in multiple forms of massage, and it's best to call in to ask for more details about that.
Okay. Someone is asking if you'd be willing to share your presentation slides.
Oh yeah, absolutely.
Okay.
I'm Liz. I'm guessing some of these are saved onto the Valley website.
Yes, I can. We can send them out
Hmm.
if you're okay with me sending the slides. We can send them out from our office.
Okay, yeah, sure.
Okay. Um, and let's see. Is there also a chiropractor in your office as part of your team?
Yes. So we have two chiropractors, Dr. Nazi and Dr. Markar. Also very well experienced in chiropractic adjustments. Dr. Nazi has been practicing for like 30 years now. She had her own private practice. Dr. Markar has extensive experience and both have been great. I personally get adjusted by them too, so it's been helpful getting that kind of treatment here. So it's it feels great to me. I'm pretty sure Christine would say the same thing too.
That's great. Here's someone saying a great presentation and thank you. There was another question that came in that I I asked them to clarify. So if we want to give them a moment,
Sure.
otherwise I will start my closing remarks. I just want to thank you both for your time this evening, and again I apologize to everyone for our technical difficulties at the beginning. As I mentioned, this has been recorded and it will be posted on Valley's website probably by early next week. Um, Also, I'd like to remind everyone if you wouldn't mind taking a few minutes to fill out the survey link. That's going to be emailed to you shortly. We would very much appreciate it. And if you're interested in any other Valley Live events, please visit valleyhealth.com/events for upcoming programs. And I also want to extend a thanks to the Montvale Library and to George